Today, I wanted to talk about some of the top 3 questions that I get asked on a regular basis about Medicare. And so one of the biggest questions is why Medicare Advantage plans, are they bad? People ask me all the time if Medicare Advantage plans are bad. And is anybody on a Medicare Advantage plan currently? I thought I just saw a question slide up really quick, but now I can't see it. Medicare Advantage plans versus traditional Medicare they're different plans, and they're different for every single human being. I use my parents as an example all the time. My mom wanted a Medicare premium she could budget for, and so she never wanted anyone to tell her that she couldn't go to a particular doctor. So she went where Medicare was her primary, and then she got a Medicare supplement and then a prescription drug plan. So all three separate premiums, but she could go to whatever doctor she wanted to go to. My dad, he didn't want to pay a monthly premium because he never went to the doctor, and he didn't mind being in a network. And so he joined an Advantage plan. And Advantage plans offer things like dental and vision and hearing. Those are things that Medicare doesn't cover. And so for that reason, sometimes the Advantage plans are really great. Now, what is fabulous, some of the Advantage plans are nationwide now, so you can use them everywhere in the United States, and you're still considered in network. Some of them are just county based. So everybody's situation is so different and so unique that you really need to have a really great conversation with an advocate to kind of identify and determine which is the best plan for you. Everybody's situation is different. So are Medicare Advantage plans bad? No. But what is bad is the Joe Namath commercials and the 1-800 Medicare commercials that you call into. Those are bad because you're just calling into 1-800 I don't care phone number, and they're putting you onto some random plan, and maybe it's not the best plan for you. Maybe they didn't ask all the right questions to make sure that throughout the whole year this is going to be a good plan, that you're comfortable with the copays, the deductibles, and how all the things work. And so for that reason, they get a really bad rap because these agents that are signing people up, you can never get back in touch with them, and they really don't care. And if the plan changes next year, then they don't call you and tell you and say, hey, let's reevaluate your, thank you so much for saucing me a like there. I really appreciate that. And so I'm here to answer any questions that you may have about the differences between a Medicare supplement and a Medicare Advantage plan. For example, I had a lot of people this year that wanted to get the dental, vision, and hearing coverage and be on a plan that was similar to a Medicare supplement. And so one of the carriers put out a Medicare supplement pseudo Advantage plan. It was a PPO plan, had a monthly premium, but it's been working out beautifully for so many people that still wanted all of the freedom of going to their own doctors, not having tremendously high copays and maximum out of pockets, and then also being able to enjoy the dental and the vision and the hearing benefits. So those are some really great things, but there's definitely a lot of information about whether a supplement is better or an advantage plan is better. And I think that it is a situation by situation. Another big question is Medicare. Will Medicare pay for home health care? That's been another big situation that I've been asked a lot recently. Medicare does not pay for home health care. And if you do have a Medicare supplement and you spend 3 consecutive nights in the hospital, go directly to a skilled nursing facility or then go home, it does then cover up to 100 days if you're on a Medicare supplement. If you're on an Advantage plan, it covers up to 20 days. So that's a big one of does Medicare cover home health care? It does not. Traditional Medicare, a couple of other things that it doesn't cover is Medicare does not cover dental, does not cover vision, does not cover hearing. So I'd love to know your thoughts, your questions. Does anybody have any concerns about Medicare, about when to start it? There's been a lot of questions about penalties. A lot of people are continuing to work. So a lot of people will ask me about when they're turning 65, are they going to get penalized because they're staying on their group plan? And so the group plan, as long as the group plan has allowed you to stay on, you can stay on your group plan as long as you want to, and you do not need to sign up for Medicare Part A or Part B. You do want to always check to see if the benefits are better, but you don't need to sign up for Medicare Part A or Part B and pay that monthly premium. So that's a big question. When can I sign up? When is it the right time? And you know what? The right time is when you're darn ready to retire and you're ready to take out your benefits. That's the right time. Again, you know, with the plans, you need to know which is going to be the best plan for you. How do you know? Because a lot of people just go with whatever plan their neighbor's on, or, well, my mom and dad have always had United Healthcare, so I better stick with United Healthcare. Well, United Healthcare may not be the best plan for you, and you don't know that until you compare all the plans. The other thing that a lot of people don't realize is the plans change every single year. And we're coming up very soon. We're doing all of our certifications right now for the 2024 year. A lot is changing, and some good stuff, some bad stuff. But the biggest thing is you need to be in the know, because when the stuff goes down, that's when sometimes people are in the know, and that's never good. Another question I get asked a lot is, are Medicare premiums based on income or the amount that you use your plan? The answer to that question is no. So Medicare premiums are not based on your income for the supplements. Medicare premiums are not based on how often you use it. I will get that call a lot. As people's plans and rates go up, they'll call me and say, well, I used my plan so much, I don't blame the company for giving me a rate increase. It has nothing to do with how much you use the plan, and it has nothing to do with how much money you make. Okay, your supplement rate. Now, your Medicare Part B premium, that does have something to do with how much money you make. And so it gets a little bit confusing, and a lot of people get those mixed up. So just a little recap. Medicare Part A has no cost. Medicare Part B does have a cost, and that cost, that's the one that's linked to your income. So for example, for 2023, if you're making under $97,000 for a single person, or $194,000 for a married couple, then you'll fall into the average Part B premium, which is $164.90 for 2023. They have not given us what it's going to be for 2024, but you will better believe I'll be on here telling everybody. The supplement cost, though, has nothing to do with your income or how often you use your coverage. That is regulated by each county, each state, and they have to file with the state if they want to do a rate increase, and the rate increase has to go all across the board with all of the people that are your age and your zip code. They all have to get that rate increase. And you know, like for lots of states have really different rates. Significant rates are very different. And so like in Phoenix, Arizona, there's a lot of seniors, a lot of people that are on Medicare. And so we're really lucky. Currently, rates are still real reasonable, but they do go up. The rates do continue to go up each year, especially if you're on a Plan F. Now, that's a big topic right now. Do you stay on Medicare Plan F, or do you go on to Medicare Plan G, or even Medicare Plan N? Any questions out there about that? Just go ahead. If you have questions about anything related to Medicare, go ahead and type them in. Or you can go to my website at www.enrollmentbenefitshub.com. The website is in my bio. And there's a section there where you can ask questions if you want to do questions in private. You can certainly message me, send me a private message, because I do know everybody's situation is so different. But what's happening currently with Plan F is that obviously if you're on a Plan F, you are grandfathered in, which means you don't ever have to get rid of it. But what that also means is that people that are on Plan F are dying, so less people are on Plan F, or they're getting off of it, but no new people are enrolling into Plan F. And so many of the people that are on Plan F are unhealthy and they can't make a move. And so what that means for Plan F'ers is that your rates are just going to keep going up and up and up because there's no new healthy people coming in to make the rates go down. So that's a big thing to really talk to your agent about, talk to an advocate about, talk to anybody that is an expert in this area. Do I stay on Plan F, or do I move to a Plan G or a Plan M? The biggest difference between F and G is that on a Plan F, you pay your monthly premium and 100% of everything is covered. On a Plan G, you pay your monthly premium plus the first annual Part B deductible, which for 2023 is $226. Once that $226 is paid, then 100% of everything is paid. So Plan G, in my opinion, is a really strong plan. A lot of agents are out there talking about Plan N, as in Nancy. Plan N is you have up to a $20 copay every time you go to the doctor, and then a $50 copay if you go to an emergency room, and then you still have to pay that Part B deductible of $226. The biggest difference between Plan N and Plan G is the Part B excess charge. So for example, in Arizona, we have the Mayo Clinic here. which if I get diagnosed with something catastrophic, I want to make sure I go to the Mayo Clinic, right? I mean, they have the best health care and the best coverage and all of that. And so I want to go to Mayo Clinic. Well, if you go to Mayo Clinic, and so Mayo Clinic says, we will take you, but we do not accept Medicare assignment. What that means is if you want to go to the Mayo Clinic for, say, for example, a knee surgery, they say, that's great. We're going to go, we're going to take that. And Medicare says, okay, we're going to pay $100,000 for that knee surgery. And Mayo Clinic says, great, we're going to take that $100,000 and then we're going to charge the beneficiary, which is you, $115,000 because they are able to charge 15% more than what Medicare deems approvable. And so what happens is they charge more. And if you have a Plan N, that Plan N does not cover the excess charge. So, just you have to know all of those things, and you have to really weigh, is my monthly premium of saving, sometimes the Plan N is $20 a month less expensive, but yet you go to the doctor, 6 times a year. Well, every time you go to the doctor, you have to pay $20. So are you really saving the $20? I guess 6 months worth, but those are all the things that you really want to pay attention to when you're making your decisions, because you may not be able to make this decision again. You may only be able to make the decision once. And because in order to make any changes, you have to health qualify for changes. And you may not be able to health qualify. I know I've talked about, a couple of my clients or people that I've talked to that have told me, you know what, let's just wait until Nebuary. I always call it Nebuary because it never can happen. And if you wait and then something happens, like I had a dear friend that wanted to wait while he traveled around Europe until he got back. Well, he got back and a week later he got diagnosed with bladder cancer. And now he's stuck. 20% is what he has to pay for everything because he only has Medicare Part A and Part B. So those are some things. So I just thought I'd come on here and give you guys some of the questions that I get asked a lot, and give you the opportunity to ask any questions. I'm going to continue to just come on and give as many as I can. Some of the other questions I have is Medicare and Medicaid the same thing. Medicare is what you've worked your whole life for. It is what you've paid into with your taxes for all of your working years. And Medicaid is a state and federally funded program that helps those that are financially less fortunate and are not making the income that is necessary to participate in Medicare. So they come in and they provide help for those people that are making less than a certain amount of money, and every state has a threshold that potentially is different. So you want to check with your state to see if you qualify for those benefits. Right now, those commercials are just going gangbusters about qualifying for getting your Part B premium paid or your flex card or all of that. And people do get freaked out because they want to know your zip code. The zip code is relevant, and that's another question, is what does the zip code have to do with anything? A zip code when it comes to Medicare is relevant because, like I was saying earlier, there are certain zip codes where there's an excessive amount of seniors, then there's less seniors, and so the brackets of what people pay, it's all around those zip codes. And some plans are accepted in one county, not accepted in another county. again, zip code based. So zip codes do matter with your coverage. But those are some of my top questions that I just wanted to get on and answer for you today. Nobody's asked any other questions about Medicare. And I guess the good news is there's going to be a big push coming up here soon where people are going to be getting so much stuff in the mail, and so many commercials are going to be coming out. So you'll really want to pay attention to those or not pay attention to them. I mean, a lot of people are ignoring everything because they think it doesn't pertain to them. But feel free to just message me, go onto my website. I did write a book about Medicare. It's a free download on my website. Oh, good. A question. I'm 61 on SSDI time for me to switch over to Medicare. Medicare for you, Debbie, is going to start when you're 65. Even though you're turning 62, that's when you're eligible to transition to your Social Security that you're entitled to. But Medicare will start over, or will start for you when you're 65. So even though you're on SSDI, unless you are on disability, then you qualify for Medicare benefits. And if you've been on the SSDI with disability for 24 months, then you are eligible for Medicare. So if that's the case, that's exciting news for you, and that's amazing. And feel free to reach out to us, and we can give you some free information about some different choices that are available to you. Okay, with disability. Okay, awesome. And so have you been for 24 months is my question. And because if you have, then your Medicare is eligible to start. So you should get Part A and Part B as long as you've been collecting for 24 months. Okay, yay! Okay, wonderful. That's exciting news for you. Well, I'd love to be able to schedule some time where we can discuss what your options are. Feel free to either message me or and get me your information. You can go to www.enrollmentbenefitshub.com. There's a place where you can schedule a free appointment. Just use the code referral for a free consultation, and we'd love to go over what all of your options are. There's either myself or I have a team of 4, and there's no charge for us to go over that. We are licensed in all of the states and represent all of the different plans. So Debbie, I'd love to be able to help you with that, or at least just show you what your options are, and what you do with that is up to you, but so exciting. So not go with insurance plan and still pay Medicare per month. Well, depending upon what state you're in, because again, this is state and county based. So, for example, if you are here in Arizona, yes, you're going to pay the Medicare Part B premium, and unless you qualify for, NC, North Carolina. Okay, I would need to look that up for you. I am licensed there. I don't remember what the rule is there, but you would qualify for the opportunity to get an Advantage plan. And I need to just double check to see if it's a state that is eligible for you to get a Medicare supplement plan, but you would qualify for Medicare and an Advantage plan. So that would be one of those plans that gives you all the dental, the vision, the hearing, and gives you that. So that would be something to really look into, and your options are phenomenal right now. You can keep it where you just have Medicare Part A and Part B, and then you get a prescription drug plan, but I would highly recommend covering that other 20%, because that only covers 80% of your benefits. So That's exciting for you, though. I'm so excited. But yeah, I would love to be able to give you some more specific information based on your situation. Also, depending upon your prescriptions, that would play a big part in it, because you would want to make sure you got a plan that covered your specific prescriptions at different tiers. They all cover that. So prescriptions plays into a big part of it too. So thank you, Debbie, for asking the question, though. And I'm so excited for you. So anyway, that's okay, good. I'm glad that you're on a lot and you'll talk to me soon. Perfect. Okay. Well, I'm always here every day, and so you can definitely find me here. There's just so many great opportunities. The sad part for me is for people that don't reach out or don't ask the questions, and they don't realize what they're missing out on for their coverage. And if you're like most of the people that I work with, people want to know all the benefits that they're entitled to. They don't want to find out that they are missing out on benefits because it's too late. So that's the biggest thing is, just when you figure out and learn what it is that you have available, that's the big thing. That's the win. Because, I know for myself, it gets really frustrating when, for example, if you've been diagnosed with something and somebody tells you, like you've got acid reflux, for example, and then you're just suffering and suffering and suffering, and then all of a sudden somebody says, hey, try taking a tablespoon of apple cider vinegar, that will cure it. I would never think that in a million years, because it's apple cider vinegar with acid. Like, that doesn't even sound right. But let me tell you what, it totally works. But thank God somebody mentioned it to me, and I listened, so that's a really silly, funny little example. But I'm just saying, if you don't know what you don't know, and you don't know what you're missing out on until you've missed out. So don't miss out. I'm free, and you might as well reach out. Why not? So, all right, well, I hope that this has helped somebody. I think that at least I was able to have a great conversation with Debbie, and I appreciate you. And I appreciate everybody else that's on and listening. And hopefully I was able to give people some information. Share me, like me. I just want to get the information out to as many people as I possibly can. And I just hope you have an amazing night. And I love you all. All right. Thanks. Bye.